We're here to talk to you about the developmental test of visual motor integration. So here are pictures of the test that we'll be talking about. This one is the VMI. This is the subtest of visual perception. This is the subtest of motor coordination.
So this assessment looks at age-appropriate visual motor integration skills. It's a combination of cognition, coordination, dexterity, vision, and perception. It's a poor indicator of handwriting alone, so it's suggested that it's used in a broader context of occupation. There are two versions, a short test and long test form. They have a different amount of items, but they take about the same amount of time to administer. The subtests take about 5 minutes each, and it can be administered individually or in groups.
So for the age range and population that this assessment can be administered to, the short test form is standardized for ages 3 to 8. Long test form can be administered to older children, adolescents, and adults with developmental delays. The subtest visual perception is standardized for age 2 to 18 and motor coordination for age 2 to 100.
So the main portion assesses the coordination between visual perception and fine motor control systems. And then the subtests isolate visual perception and motor coordination from their integration. So visual perception looks at how well the visual system perceives the information coming in, and the motor coordination looks at the level of fine motor control that the individual has.
So for administration, you can administer all 3 tests, but if you do that, the VMI should be administered first, then visual perception, and then motor coordination. And for all of these, the test booklet is placed face down in front of the client, and the client's body should be centered to the test booklet through the entire administration. And the client is encouraged to hold down the text booklet while they're writing. But if they can't do this for any reason, the examiner can hold the book for them.
So for the main portion, the individual is given a booklet that has increasingly complex geometric figures to copy with a pencil, and they're not allowed to rotate the book or erase any marks. The visual perception and motor coordination portions are timed. So for the visual perception, you have 3 minutes to do as many as possible. And instead of copying them, you're just identifying their identical match from a set of similar shapes that they give to you. And then motor coordination, you have 5 minutes to do as many as you can. And in this one, you're given specific directions to trace figures without crossing over their border.
So this is a YouTube video that we included to show you more of a detailed explanation about the administration of these assessments. We're not able to access the manual online. So this video does a really good job explaining how to administer and some of the scoring of the VMI and both of the subtests. Okay, so for the norms, they're based on a large sample of children and adults, almost 3,000 participants. And for adults specifically, these norms are important because the visual constructual deficits that an adult may have can be an early indicator of dementia. A standard score, in the standard scores, the mean is 100 with a standard deviation of 15. And most of this normative information that's age specific and diagnosis specific is going to be found in the manual that we do not have access to.
So for pediatric population specifically, the VMI has adequate to excellent reliability and validity.
So for scoring, the scoring for this assessment requires a protractor and the manual because there are a lot of specific details, especially for the first part about the number of degrees that each mark has to be within and how the lines intersect, etc. But 1 point is awarded if no mark on the test form goes outside the edges of the paper. And a ceiling score is established if 3 consecutive shapes are not passed. And if the copied form goes slightly outside the box, but all of the other credit or all of the other criteria is still met, the person will still get credit for that item. And it's really important that you always score the first attempt, even if the client tries it twice. And all of the results are reported as standard scores, percentiles, age equivalents. These are all found in the manual. You basically have to convert the raw score to a standard score, and then you get the percentiles and age equivalents from those.
So the only biases that we found or came up with were if somebody has very poor handwriting or motor or cognitive deficits, including being able to understand the directions to the assessment.
So thanks to our classmates, Madison and Michaela, we got, we forged some pictures of the assessment. It's really hard to find them online, but this first video is of the VMI portion, and there's, Madison's just gonna go through the 30 items and show you what they are. And like we said, for these ones, the examinee will just copy the image to the best of their ability. Then you'll go back and score after based on those specific standards. And the images increase from simple to more complex as they get to the end. Okay, so that's it for that one. And then next we have the motor coordination subtest pictures.
So for this one, the individual will trace inside the borders using the large dots. But as we see as it goes on, it gets more complicated because you no longer have the dots anymore.
And that's it. Thanks.
Thanks, everybody.